The Florida Department of Health understands that some of you may be concerned about your pets. The CDC has not received any reports of pets or other animals contracting COVID-19. However, it is always a good precaution to wash your hands after touching an animal. People with COVID-19 are asked to limit interaction with pets and other animals. Specifically, while they are symptomatic, they should maintain separation from pets as they would with any household members, and avoid direct contact with pets, including petting, snuggling, being kissed or licked, and sharing food. Please visit floridahealth.gov and the CDC websites to stay informed. The length of time that COVID-19 survives depends on factors. These factors include the type of material or body fluid containing the virus and various environmental conditions such as temperature or humidity. Researchers at the CDC and other institutions are designing standardized experiments to measure how long COVID-19 can survive in situations that simulate natural environmental conditions. So until more is known, clean often, especially high-touch surfaces. This is a stressful time for everyone, including children. Provide your children with opportunities to talk about their feelings. Regardless of your child's age, he or she may feel upset and have other strong emotions. Encourage them to share their concerns and ask questions. The following websites have more information on this topic. You can also email DOH Hillsborough PIO at flhealth.gov. The length of time that COVID-19 survives depends on factors. These factors include the type of material or body fluid containing the virus and various environmental conditions such as temperature or humidity. Researchers at the CDC and other institutions are designing standardized experiments to measure how long COVID-19 can survive in situations that simulate natural environmental conditions. So until more is known, clean often, especially high-touch surfaces. Hi, my name is Kevin Watler, and I'm the Public Information Officer for the Florida Department of Health in Hillsborough County. Florida Department of Health has joined Nextdoor to share information and updates that have direct impact on your neighborhoods. Let me assure you that your Nextdoor neighborhood conversation remains private to you and your neighbors. We only will be able to see your replies and posts in private messages that you send directly to us. It's our plan to keep you informed. It's important to prepare your household for the coronavirus. COVID-19 cases continue to increase around the state. A coronavirus outbreak could last for a long time, and we recommend a 2-week supply of prescription and over-the-counter medications, food, and other essentials. Also, know how to get food delivered if possible. Having a household plan can help protect your health and the health of those you care about. The following websites have more information on this topic. You could also email DOH Hillsborough PIO at flhealth.gov. The Florida Department of Health wants you to protect your family and friends from COVID-19. We are all at risk of transmitting the coronavirus to someone who may not be able to recover if they get it. It's important to understand that people who are older and those with medical conditions such as blood disorders, chronic kidney or liver disease, have a compromised immune system, a current or recent pregnancy, heart disease, lung disease, or a neurological condition are at highest risk for a bad outcome. Please visit floridahealth.gov and the CDC websites to stay informed. It's important to protect yourself when you go shopping. Wash your hands before and after going to the store. Shop at off-peak hours so it's easier to keep a distance from others. If you're over the age of 60, see if stores in your neighborhood are offering shopping exclusively for seniors. Don't touch something at the store and then touch your face. Use a sanitizing wipe to disinfect the shopping cart or basket handle. Many stores provide wipes, but you might want to come with your own supply just in case they're out. The Florida Department of Health, along with its partnering health and safety agencies, is reminding residents to stay vigilant and help stop the spread of COVID-19. People with confirmed or suspected COVID-19 who do not need to be hospitalized, or those who were hospitalized and determined to be medically stable to go home, should restrict activities outside their home except for getting medical care. Do not go to work or public areas. Avoid using public transportation, ride-sharing, or taxis. Be sure to separate yourself from other people or animals inside your home. You should stay in a specific room and use a separate bathroom if available. Call ahead before visiting your doctor. If you have an appointment, call the healthcare provider and tell them your symptoms. This will help the office take steps to keep other people from getting infected or exposed. Household members and caregivers who have close contact with someone who has confirmed COVID-19 should stay at home and monitor their own health and call their healthcare provider right away if they start developing symptoms. We encourage residents to visit the Florida Department of Health and CDC websites for more on this topic. The Florida Department of Health wants you to keep practicing social distancing. If you need fresh air and would like to do some outdoor exercise, that's okay. However, if you're around other people, keep 6 feet between you when possible. Avoid hugs, handshakes, large gatherings, and close quarters. If you have a cough, fever, shortness of breath, or sore throat, stay away from others even if they're in your same household. Doing your part will save lives. Please visit floridahealth.gov and the CDC websites to stay informed. The Florida Department of Health wants to stress the importance of speaking with your healthcare provider. It's a bad idea to self-diagnose and tell a healthcare provider, I have COVID-19, I need to get tested. A healthcare provider may not take you seriously if you do. If you have a fever, cough, or trouble breathing, call a healthcare provider and describe your symptoms. Your healthcare provider will then help you with your next steps. To be safe, you should avoid close contact with others, especially those in your household, until you know more. Please visit floridahealth.gov and the CDC websites to stay informed. If you live alone and become sick during a COVID-19 outbreak, you may need help. Ask family, friends, and other healthcare providers to check on you during an outbreak. Stay in touch with family and friends with chronic medical conditions. Please visit floridahealth.gov and the CDC websites to stay informed.
The Florida Department of Health has teamed up with Hillsborough County government and other public health and safety agencies to address any impacts coronavirus may have on our local community. Not everything is known about the coronavirus yet, but the Center for Disease Control and Prevention, CDC, has narrowed down key symptoms of the virus: fever, cough, and shortness of breath. The CDC says these symptoms may even appear 2 to 14 days after exposure to the virus. If you experience these symptoms, you're urged to stay home and call your doctor. It's important to know the difference between symptoms of the coronavirus and other illnesses. The CDC says people who have the flu will often feel some or all of these symptoms: fever or chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, allergies. The common symptoms of seasonal allergies include sneezing and an itchy, runny, or congested nose, itchy, red, watering eyes, wheezing, chest tightness, shortness of breath, cough, raised, itchy, red rash, swollen lips, tongue, eyes, or face, dry, red, and cracked skin. You should call your doctor if you develop symptoms and have been in close contact with a person known to have COVID-19 or have recently traveled from an area with widespread or ongoing community spread of COVID-19. We encourage you to visit floridahealth.gov for up-to-date information and tips.
The Florida Department of Health is working around the clock to identify those who are most at risk of contracting COVID-19. We are prioritizing testing for any individual who is symptomatic, fever, cough, shortness of breath, and has traveled through an area of community spread. We encourage them to contact their medical provider. Please don't self-diagnose. Describe the symptoms that you are having, work with your provider, and if your provider feels that you meet the criteria for COVID-19 testing, they can coordinate through one of the commercial labs, LabCorp or Quest. There's a two-step process, which includes a specimen collection kit and then a test kit. The specimen collection kit includes the swabs and the sputum culture that are collected from the patient, which are then sent to the lab where the testing kit is housed. The testing kit includes reagents, which are basically chemicals that run the test to prove whether the person is positive or negative for COVID-19. We encourage social distancing because it is very easy to spread through droplet transmission, meaning if someone coughs or sneezes near you and you breathe that aerosolized matter in, you are now possibly infected with the virus. We want to isolate the sick for 14 days because that's typically the duration of this virus. At the end of the 14 days, if they are symptom-free, then they have the potential of testing negative for the virus. But they do have a clearance process for those individuals. For the latest information on the COVID-19 virus, we encourage everyone to visit the Florida Department of Health and the CDC websites.
Once the Florida Department of Health has confirmation that someone tests positive for COVID-19, we go over where they've gone and who they may have exposed while they were infectious. Then, we speak to the person and go over do's and don'ts. They are given a way to get in touch with us directly 24 hours a day, 7 days a week. When we check on the individual, we continue to remind them of do's and don'ts. Each situation is a little different. Some people live alone, some live with others, some may have to temporarily relocate to protect high-risk family members. We work with the individual, the immediate family if they have one, and community partners to ensure their needs are being met. If someone is exposed and infected with COVID-19, the virus will not show up in a test until 2 to 14 days after the exposure. In the early stages of the infection, it is possible the virus will not be detected, which gives a false sense of security. That's why it's important to have a healthcare provider determine the best time for a COVID-19 test. Please visit floridahealth.gov and the CDC websites to stay informed. A recent study shows young people can develop serious COVID-19 illness. A CDC study published on March 17th shows that younger people can develop serious COVID-19 illness requiring hospitalization. This finding is different from the first reports from China. That said, younger people are still much less likely to die from COVID-19 than older people. Each day we learn more and more. Please visit floridahealth.gov and the CDC websites to stay informed. The Florida Department of Health understands that some of you may be concerned about your pets. The CDC has not received any reports of pets or other animals contracting COVID-19. However, it is always a good precaution to wash your hands after touching an animal. People with COVID-19 are asked to limit interaction with pets and other animals. Specifically, while they are symptomatic, they should maintain separation from pets as they would with any household members, and avoid direct contact with pets, including petting, snuggling, being kissed or licked, and sharing food. You may be wondering if the COVID-19 virus can be spread through drinking water. The COVID-19 virus has not been detected in drinking water. Conventional water treatment methods that use filtration and disinfection, such as those in most municipal drinking water systems, should remove or inactivate the virus that causes COVID-19. Many of you may be wondering if the COVID-19 virus can spread through pools and hot tubs. Well, there's no evidence that COVID-19 can be spread to humans through the use of pools and hot tubs. Proper operation, maintenance, and disinfection of pools and hot tubs should remove or inactivate the virus that causes COVID-19.
Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community to help prevent the spread of the coronavirus.
Clerk, please call the roll.
Good afternoon, Miller.
Here.
Overman. Merman.
Here.
Cronister.
Here.
Gasser.
Here.
Ross.
Here.
Lott.
Here.
Snidely. And Merrill.
Here.
Thank you. You have a quorum.
Okay, thanks. I think we're missing Commissioner Overman and Ms. Snively, if I'm not mistaken. Okay. Dr. Holt, are you on the phone with us?
Yes, sir, I am.
Okay. Good afternoon, sir. You're recognized for a Department of Health update.
Yes, sir. Again, I think what we all know is COVID-19 is continuing to show itself as both insidious and vicious in some of our populations. The public health investigation to date, as of 4/6, we've had 570 cases identified. 10% of these are between the age of 55 and 65, and 10% over 65. Typically, over the last 7 days, we've seen an average positive reported about 40 a day. Estimated doubling is about 5 days. I checked or did an analysis of how many people per thousand are in. What this would translate into. We're at 0.4. I use that as a comparison. The data for Miami-Dade is now 4 times that, and Broward is 2.5 times. We have 38 people hospitalized with 14 in the ICU, 10 of them on a ventilator. Same numbers for Broward. They have 339 hospitalized, 100 in the ICU, and 87 on ventilators. We continue to actively monitor the daily numbers, new admits, discharges, and others, and that's where we are with the cases right now. Public health investigation remains focused on those that need urgent response to potential spread within our most vulnerable, our healthcare workers, and those at risk for severe disease. Social distancing, please, please, please. I think this is the time to continue to reinforce that. Ask us all to take personal responsibility. Essentially, finish your day every day and don't infect anyone else. Preparations for a hospital surge. Mr. Merrill convened a call between the CEOs of Adventist Health, Baycare, HCA, and Tampa General to coordinate how any alternate care or field hospital would fit into their existing surge plans. Each hospital and their system already have their own, and as you can imagine, just like healthcare, it's a regional issue. Gene Early then facilitated a follow-up call with each of the designees of each hospital who shared their more specific plans and discussed any possible best use of an external facility, one that would be utilized by them all. The summary findings were that that each again reinforced each of the healthcare systems have the plans and prepared to take the steps necessary to meet their surge by expanding ICU beds in the hospital, reusing PPEs and other. Common agreement was that the ICU patients should remain hospitalized, not to use the ambulatory surgery centers, and make a request for one of the 2 field hospitals the state has staged for deployment, and it would be used for low acuity COVID-19 infected persons. The facility does come with a contractor to staff, equip, and run the facility. We made the request, and at this time, it was on hold based on circumstances that they're monitoring as far as the use of that asset. We are making progress on our care coordination and management plan for outpatients. Florida Department of Health and USF have formed their partnership that we are working to screen all of those patients that test positive. USF students, under the supervision of faculty physicians, have started doing their initial medical assessment and the subsequent follow-up of those patients. Certainly want to thank and recognize Dean Charlie Lockwood and Dr. Asa Oxner for those initiatives. We will be establishing contact points for each of the hospitals so we can begin to assist and coordinate all their discharge or the non-medical needs of their patients that they are following. Long-term care facilities, as we talked about the rapid response, we did activate that over the weekend based on a positive test from a resident or staff. This has happened in 36 other counties before. Our step is we go in with a team. We did a triage of the medical needs of the residents to assist with the meeting those needs. We've identified any potential exposed, continue to follow them, assess their needs, provide PPEs or other equipment they have, and then have actively monitoring any residents and staff for any secondary infections. Our main challenges, I guess, are clearly to continue to work very closely and collaboratively with our community and our healthcare system. As patients are admitted and they recovered, we are working to find the best place for them to be discharged. And if not at home or hotel, find an alternate care for that. So we've been trying to use this time wisely. We'll continue to need to be very flexible in our actions based on what we encounter, and use certainly all we have. Conclude by saying the obvious: this COVID it moves fast, it's bad, and we got to try to get ahead of it. That's where I'll stop, sir.
Thank you, Dr. Holt. I see some hands up. When I call on you, please remove your hand signal on here, so I won't call on you again. Ms. Snively, you're recognized.
Thank you, Chairman. I just wanted to be accounted for the record in attendance.
Okay,
Sorry.
can you remove your hand?
Yep,
Okay.
Thank you. Yes, sir.
Commissioner Merman, you're recognized.
Thank you, Mr. Chair. And Dr. Holt, I wanted to ask you, because it's coming out as a suggestion for people to start wearing masks. And so is that something the Department of Health is going to actively recommend to our community? Should the Joint Communication Group get together and issue recommendations on the mask? And how do you feel about that?
Yes, ma'am. And as you may recall, in the very first meeting at the Board of County Commissioner, I was one that I said I certainly wouldn't demonize anyone wearing a mask, and that was about a month ago. This is now the CDC recommendation, and which we support. I personally feel the same way. I'll stop there.
Okay, so do you think the Joint Information Group should issue a recommendation to our county for people to please start using a mask when they're out in public?
Yes, certainly. I had the experience over the weekend, and I noticed a large percentage of people acting upon that already. But certainly, any reminders, any encouragement of any and all steps that we can do to prevent this. Understanding what the masks are designed to do under this situation is for those people who are asymptomatic. To reduce the spread. So it's almost like having a continual sleeve on your nose, if you will, if you were coughing and things. There is some risk still with your hands, and you got to be careful not to pick something up and then the mask, adjusted. So that's just something to be conscious of. But, to me, if I see someone a mask, I think they're doing good service to reduce the risk that they may have to infect others. I'll stop there.
Okay, so I'll ask Mr. Merrill, do you think we should send this issue to the Joint Communications Group and see how they want to handle it and getting the word out to the community?
Yeah, we can certainly do that. I'll make sure that happens.
Good, that's great, thank you.
Commissioner Merman, remove your hand, please, if you're done.
Sorry.
Okay, I have a, I don't know what this name is, DLUSCZYN. Who is that?
It's Donna Lazinski. I'm sorry, that hand's in error.
Pardon me?
It's Donna Lazinski with the Sheriff's Office. The hand's in error.
Okay, you wanted a question? You have a question?
No, sir, it's just not coming off my board.
Okay, all right. Commissioner Overman, you recognize.
Thank you. In line with Commissioner Merman's comments, I had some similar questions. And I do truly appreciate all the work that Dr. Holt is doing. I think it's important that we get his messages out as much as possible and make sure we do it clearly. We have the emergency system where we communicate by telephone to our citizens. Given the change in the CDC recommendations and the urgency of keeping people at home and following social distances, can we use their call systems now to get that message to so many people who may or may not have internet? I'm sure Ms. Snively has discovered how many of her students probably don't have internet learning capability and what a mammoth task that is. And since it's so important, is it possible that we could use our telephoning our citizens to give them an update on the best practices for staying safe and to reduce the community spread that we're experiencing? And I'll close there.
Dr. Hope?
Tim, are you on the phone? This mic.
No, I'm on the system.
No, Tim Dudley.
Oh, Tim Dudley. Oh, okay. Sorry.
Yes, sir. We can certainly work with the JIC to get the message out.
Okay. Well, I don't see anyone else's hand up. So Dr. Hope, thank you very much, sir. We appreciate it. Mr. Dudley, you're up.
Good afternoon. Good afternoon. Current EOC actions today. We continue to support operations at Raymond James Remote Collection from 8 a.m. to 2 p.m. Through April 8th. We are discussing additional collections ongoing. We've collected 357 samples this past Friday. 311 appointments for collections were scheduled for today, and 7,744 additional collection kits have arrived for the county collection sites. We continue to support operations of the county quarantine and isolation sites. Both sites currently have guests. There are 6 guests in the isolation site, and there's currently 1 guest in the quarantine site. We continue to support planning for alternate care sites, continue to coordinate logistics, receiving, staging area, and distribution. We have 1,100 requests filed with the state. We continue our donations operations warehouse at 250 West Shore Plaza to receive medical supply donations from the community. Operations are from 9 a.m. to 3 p.m. Monday through Friday. This concludes my update.
Okay, Mr. Dudley, thank you very much. And I don't see anyone having any questions at this particular point in time. So thank you very much. Federal and state update, Mr. Wagner.
Good afternoon, Mr. Chairman and members. This is Brandon Wagner, Chief Government Relations and Strategic Services Administrator, with a very brief update on federal and state activities since our last call on Thursday. In the area of federal funding, as we previously outlined, agencies are continuing their efforts to implement the CARES Act and distribute resources as soon as possible. Of note, the Small Business Administration on Thursday evening released their interim final rule for the Paycheck Protection Program provision of the bill. This is the $349 billion in forgivable loans to small businesses to pay their employees during the COVID-19 crisis. The SBA administrator recently stated that more than 1,100 lenders had issued 17,503 loans valued at more than $5.4 billion. We are hearing that supply may outpace demand as the program is based on a first-come, first-served structure. So those that are interested in receiving a loan from the program would be advised to submit their applications as soon as possible. Next, we're also still anticipating final guidance within the next few days from the U.S. Treasury Department for the $139 billion in state and local relief. Again, those funds are expected to be released within 30 days, and that would place it somewhere around April 24th. Finally, there are some various mechanisms included in the CARES Act that are designed to allow for oversight of how the COVID-19 dollars are spent. It also requires extensive oversight and public reporting about how each agency is utilizing those dollars. In addition to the already existing Congressional Oversight Commission, the CARES Act also created a Special Inspector General for Pandemic Recovery, which is intended to work out of the Treasury Department and has subpoena powers. The President has nominated White House Attorney Brian Miller to the post. That will require Senate consent, but just highlighting the fact that there will be a lot of eyes watching how these funds are distributed and spent. Going forward legislatively, last week I reported on a potential Phase 4 package. Since then, some new thoughts are beginning to emerge about how that next step will be taken. It's being suggested that rather than one single bill, there may be two, with different points of emphasis and different timetables for completion. The theory is that a Phase 4 bill could continue to address the immediate crisis and time-sensitive needs, while negotiations on the recovery actions, including an infrastructure proposal, could be part of an eventual Phase 5 bill, which may require significantly more time to negotiate and implement. At the state level, since our last conversation, the governor has executed 3 new executive orders. The first provides that state personnel are lended to Department of Economic Opportunity to assist in their reemployment assistance efforts. As we're all aware, there's been significant difficulty with folks trying to apply for unemployment benefits and other needs. And so this is an attempt to provide more personnel to catch up on the backlog. The second executive order suspends any state statute providing for mortgage foreclosure or evictions under Florida law for 45 days. And thirdly, which just came out today, an executive order that suspends doc stamp collections on small business loans pursuant to Title I of the CARES Act. Members, that concludes my report, and happy to answer any questions you might have.
Thank you, Mr. Wagner. I don't see anyone having any questions at this time. So again, thank you very much. Ms. Beck, frequently asked questions and clarification of Governor's Executive Order 20-91. You recognize.
Yes, Chairman. Good afternoon, EPG members. Christine Beck, the Hillsborough County Attorney. On Saturday, we received from the Florida Association of County a listing of the FAQs for Executive Order 20-91, and it was represented that these were provided by the Governor's Office. The FAQs are designed to address some of the questions relating to the Executive Order 2091 and 2092. I will just hit the highlights. In the general area, the FAQs make it clear that the Governor's executive order was designed to be consistent with federal CDC guidelines. It also then, in a clearer manner, outlines what qualifies as an essential service, and this FAQ document takes you to a link where all of the essential services are listed out. It'll also take you to a link where it lists out all of the essential activities. Then there's some questions provided with regard to the essential services, questions and answers, I should say. First and foremost, it states that if my business is not an essential service, must I close the physical location to customers? And the answer that's provided is yes. So that is something that we discussed last week and indicated that was strongly inferred, and now we know that that is in fact the case. The following questions, though, make it clear that your business would be allowed to operate from your home or remotely, if that's possible, and that your business and its employees could also both operate remotely and provide delivery of their product. And it is emphasized that that is in fact encouraged if it's possible. There is a question relating to churches and synagogues, and it says, may churches, synagogues, or other houses of worship hold services? And the answer is yes. And then it takes you to a link or connects you to a link where the CDC guidelines are provided for religious services, and it urges the compliance with those CDC guidelines. The section regarding local governance and enforcement has the following question. It states, are local authorities allowed to adopt requirements directly on businesses, operations, or venues, including buildings, beaches, and parks that may be stricter than the governor's executive order? And the answer there is yes. So that is helpful in clarifying the order as well. And finally, it provides that the order is enforced via law enforcement and as a second-degree misdemeanor. So with that, I will stop and be open to any questions.
Thank you, Ms. Beck. Let me ask a question concerning essential and non-essential businesses and services. We have essential businesses, but in our order, we also have non-essential businesses that were, I think we said that if they were not able to work remotely, if they had to go to work and they were in a non-essential business, that could happen, they had to remain 6 feet apart. Does this now say that we have to close those non-essential businesses? Is that what I'm reading?
It would provide that if they are a non-essential business, they have to close their physical location. Yes, sir. And because of the fact that the state order supersedes ours, that would be the interpretation that would be applied to those businesses.
So now, does that mean that we have to now go back and change our executive order to match up with the governor's executive order?
I don't think it's absolutely legally required. What some counties are doing is simply allowing for the orders to stand and then interpreting them. So in this case, you would go through the analysis of the governor's order superseding and that being the controlling one, and then backing it up with information on websites and so forth to make it clear to the public. I did notice that Pinellas County put out additional guidelines, but if that is something you would like to do, we certainly can do that.
Well, that's my question. How do we handle this? How do we get the message out to those non-essential businesses that did have their physical buildings open, that they now must close those businesses, and if they can, work remotely from home? How do we get that message out? Do we do it through our communication department and our emergency management office to get that out? Do we have something we put on our website, Facebook, whatever the case may be? How did Pinellas County get theirs out?
Yes, I think the answer to all of those questions is yes. And then what Pinellas County did, as an example, is they also issued a document titled State of Florida and Pinellas County Safer at Home Guidance, where they put a little bit more detail into that, and they did an order that made it clear that non-essential businesses must close. So I think your choices certainly would encourage all of those avenues through the communications department and the joint information group, et cetera. And if this body would like to do a clarifying order or a guidance document, we can certainly prepare that.
Okay, and I see some hands up, but I just want to make it perfectly clear that we have to adhere to the governor's executive order, no doubt about that. We cannot go against his order, but it appears to me that we're about to make some other people unemployed also. And that's going to really hurt our county even more. But we must do what the governor's order said, and that is non-essential businesses must close their actual buildings. If they can't work from home, it's probably up to the business owner to either try to keep them on board or they're going to be unemployed. So our numbers are going to grow. Commissioner Overman, you're recognized.
Thank you, Chair. I appreciate it. This is part of the reason why I was eager to find out from the communications group how we could go about calling our citizens and letting them know clearly what they can and can't do and what they should and shouldn't do. We do have business licenses, so we have contact information for all our businesses. And we do have an opportunity to help our citizens recognize that either homemade masks or whatever are now recommended, which is why I asked the question, can we use our telephone as a way of very quickly getting this information out through the joint communications group? Because I think given the questions people have, even on our own board about what can be done and not, I think it's important we get that information out as quickly as possible without expecting other people to come to us to get that information. I think we need to push it. That's one of the reasons why I made that recommendation.
Okay, move your hand, please.
Thank you.
Okay, Mr. Merrill, you recognize.
Yes, thank you, Mr. Chair. So the FAQ that was published by that Christine was referring to, it was actually published by the governor's office, and was provided, I think, to all of you, is a really good document. It's easily readable. It's very clear. We can use that document along with a media release and direct contact with trade organizations and companies to get the word out. And we will do that. I think that's probably more effective than us amending our executive order and then possibly causing more confusion. So going to Commissioner Overman's suggestion about using our phoning capability, I think for something like masks, as she suggested, it's a good tool. But something like this that is more complicated and has more features to it probably doesn't lend itself to using the phone communication. The other thing about using the emergency phone connection is that we don't want to overuse it to the point where people start ignoring it. The purpose of having that is to really get people's attention quickly about an emergency that's bearing down on us. So I would say great idea to use it to notify people about masks, but I think this other issue probably can be more effectively communicated by using the FAQ document and directing it publicly generally, but also directing it specifically to business trade groups and businesses.
Okay, thank you, Mr. Merrill. Move your hand, Mr. Merrill. Commissioner Merman, you recognize.
Thank you, Mr. Chair. I thought the governor's order on essential services, this would be for Christine Beck, also included the list from Miami-Dade. And then I thought our list of essential services was identical to that, and which made ours really, basically we wouldn't have to make any changes. Has that changed, Christine?
No, Commissioner, you're correct. The essential services in the state order include both the Homeland Security listings as well as the Miami-Dade. And what the FAQ does that I think makes it a little simpler is it puts it all in one place as a list. What we said to you last week is that as we went through all of it, we believe that everything that was on our list was covered. I think the issue now is for those non-essential businesses and who they may be and the fact that they must close. We had tried to be a little more lenient with the non-essential businesses to the extent they were able to use social distancing and other things. So now it's clear that under the state order, the non-essential services must close.
So the hair salons, nail salons, all those people would absolutely have to close. Is that correct?
Yes, that is correct.
Thank you.
Commissioner Merman, remove your hand, please.
I will do it.
Commissioner Altman, did you put your hand back up?
I did, sir. It was a follow-up to Merrill's comment and answers, please. Okay, thank you very much. The reason I brought it up about reaching out to people immediately is that we are approaching major religious holidays. Easter's this weekend, which is one of the most largely attended services. Ramadan's approaching. We need people to have clear understanding of what they should and shouldn't do as they practice their faith. And if we're able to get that out to not only all the congregations, but also to the pastors and our business owners, I think it would be of great value, which is why I suggested a telephone call. I'm not suggesting we do it every week. I am suggesting we do it as urgently as possible, given that we've got a major holiday this weekend. Thank you.
Ms. Beck, is there anything else that you must bring before us, Ms. Beck?
No, sir.
Okay, thank you very much. We're now into discussion from the EPG group. Is there anything you would like to discuss at this point? Commissioner Merman, you recognize.
Thank you, Mr. Chair. And I have discussed this with Christine Beck. There's come up a situation on evictions on commercial rents. The governor's order 20-94 specifies only residential rents are exempt. The chief judge's order says all evictions are not to be carried out till April 20th. So because of this question about commercial rents, there's been several questions that have come in to me and another commissioner. Some of these landlords are trying to evict their, people that rent from them. They're trying to evict them. So I think we want to try and help them as much as we can. So I'd like to ask Mr. Merrill, who is really our lead for the emergency policy group, to get with the chief judge and our sheriff to clarify this eviction issue on commercial rents. And if they have to together request the governor's office clarify this matter of evictions on commercial rents, to the extent also, Mr. Chair, that you would send a letter on our behalf to the governor asking him to please clarify this issue, because it is starting to bubble up with many of our small business owners here in Hillsborough County.
Okay.
So that's a motion actually that I made.
Is there a second? Is there a second?
I'll second that.
Is Second by Commissioner Overman. To the motion, does anyone want to discuss the motion or debate the motion? Seeing none, the motion. Pardon? Excuse me? Okay, roll call on the motion.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Cronister,
Yes.
Castor,
Yes.
Ross,
Yes.
Lott,
Yes.
Snively.
Yes.
Motion carried.
Thank you. Mayor Lott, you recognized.
Thank you, Mr. Chairman. During obviously times like this, there's a lot of our services get stretched beyond belief, and I think all of us are appreciating all the data and the information we're getting from the different reports we receive on our meetings we have twice a week. The concern I have is because we're starting to see a little bit of spike in our community in the number of people that are Baker Act, and I would like to ask Mr. Merrill if possibly you can have someone give us a report and just kind of give us an update on where are our social services, our mental health facilities and so forth, and seeing how they're being strained. Are we right now, do they have the resources to meet the demand that we have in our county right now? And just have a really big concern, I'm sure we all do, that even though isolation and distancing is good for this virus and so forth, it does have an effect on other areas and the health of our mental capacity of our citizens in our county. And so we could maybe in our next meeting, or if that's too early, one thereafter, for us to be able to get an update on how we are meeting the demands, be much appreciated. Is that fair, Mr. Merrill?
Yes, absolutely. I can give you a little insight into that now.
Okay.
We had a discussion this morning and on that topic. So all of those kinds of social services are being coordinated through the Emergency Operations Center, along with various partners like Feeding Tampa Bay, the Crisis Center, and a host of others. And so the thing that I asked them to do this morning was to make sure that there was a clear, for the public, there was a clear way to get into the system. So a single number, single call center, so that people with any kinds of concerns, whether it be mental health, food, whatever, could clearly get into the system and get help. So I think that the network that we've built is a good, strong network. We'll beef up the entry point. But to your point, it's going to begin to strain us financially. And so some of the money that's coming down from the federal government it's a little bit unclear how we can use it, but some of that may be available to provide funding for resources. So that may help. We have a lot of employees in a number of different areas, the tax collector's office, my office, other offices that can be reassigned to help bolster the resources we have to help these folks. The Crisis Center contacted me today, or one of my folks today, asking for additional funding, and I will approve that under my authority. So that should help keep them, help sustain them in providing the kind of support for folks that you're talking about who are experiencing mental health, depression, other things. So I think we're beginning to pull this together. It's there, it's available. It just depends on how much volume. And the longer this goes on, the more people who are displaced, the greater volume we'll see and the greater financial strain. It's encouraging the federal government's going to address future disaster bills. That should help relieve some of the pressure on our reserves, which is my big concern going into the hurricane season. So if that's kind of just a brief summary, but we'll bring you something more specifically on Thursday.
Thank you very much.
Sure.
Mayor Lott, just remove your hand from the screen, please. Ms. Knight, be recognized.
Thank you, Chair Miller. I had a constituent reach out to me, and I thought I'd just bring it up for conversation today, questioning the shared mobility, like the scooters and the shared bikes that we have in the city, wondering if we should be concerned about the spread of virus through those mobility devices, just because I know that there's been a few large cities in the country that have discontinued use of those based on some of the evidence that has been brought forth regarding them being a way that the coronavirus spreads from one person to another. There was a study in the New England Journal recently that says the virus can stay on metal and plastic for up to 72 hours. So if there are people that are not properly wiping down those mobility devices, then they could be potentially spreading. So I thought I'd just bring it up to see if anyone else had a concern about that, if we should take any action on that to prevent more spread of the virus through those particular mobility devices.
Well, Ms. Snively, let me ask a question of Ms. Beck. I agree that that's a good way to spread the virus. But would they not be a non-essential business that has to close now?
Commissioner, that's exactly the question that needs to be asked. And because the various documents reference a number of different kinds of transportation, I don't recall them ever referencing this kind of transportation, so it would make sense, but perhaps that's something we could review a little more closely and report back through our communication system, as well as at your meeting on Thursday.
Ms. Slider, did that answer your question?
Yes, I think it's definitely something to look into and maybe bring some information back for the group. Thank you.
You're welcome. Remove your hand, please. Commissioner Merwin, you recognize.
Thank you, Mr.
Can't hear you.
Can you hear me now?
Yes, okay.
Okay. That was a good point that Ms. Snively brought up. I have heard from some constituents, and wondered if somebody from our Emergency Operations Center could work with Spectrum. It seems like several parents of school children cannot connect to the school system, either through Spectrum. I guess it's very difficult to have that connection so that their kids can participate in school. And I do know that in our Emergency Operations Center, we do have the utilities in there. I wondered if they could just ask those folks to work with the school system to make sure that they're addressing all those issues. And that's just a request.
Mr. Merrill?
Yes, that's a good question. We actually reached out to Spectrum last week, and in response to a question from an organization, I can't remember who, it was Dr. Leanna Fox's organization, and the Spectrum stepped up immediately and provided them with the options to connect people who don't have access. So we will make sure that Spectrum also reaches out to the school district and others. They were very responsive, so we'll make sure we get good coverage.
Excellent.
Okay, remove your hands, Commissioner Merman and Mr. Merrill. Ms. Snider, you recognize.
Thank you, Chair Miller. Just to respond to that as well, thank you for helping us out with that, Mr. Merrill. And I know that the superintendent recently also purchased 500 hotspots to be distributed throughout the school district where there is been difficulty in connectivity for the students. And just as an added piece of information for those students who do not have connectivity, they are also able to contact their school by phone and have packets prepared for them so that paper can be also utilized. They would get a week's worth of work on Monday and be able to turn it in by Friday on paper if for some reason they don't have connectivity. But we have given out about 40,000 electronic devices, and we have, 35,000 electronic devices we've checked out, and we have 40,000 more on order. So we're trying to push those out to as many families as we can. So thank you, though, for all your support.
Thank you. This is something that I probably should have brought up when Commissioner Merman brought up about the evictions. I think that I asked to write the letter. I've gotten many phone calls from people inside my district and out of my district that in the 1st of April, many of the apartment complexes raised their rents. And many of those people that live in those apartment complexes have lost their jobs. This is probably for Ms. Beck. I've got a number. In fact, I had a number of people call me this morning saying, I got a notice that they're raising my rent. I lost my job last week. What am I supposed to do? Is anything, I don't think it is, but Ms. Beck, is there anything in the order that addresses apartment complexes raising their rent at this particular point in time?
Commissioner, off the top of my head, I do not recall anything that would address that.
Is there any kind of way we could find out, or if there's anything that we can get to Tallahassee to see if the governor is willing to look into that? Maybe just postpone the raising of rents for a little while?
Perhaps that could be included with the other request.
Is there any objection to that being included in the letter that Commissioner Merman mentioned earlier?
No.
Any objection to that? Do I need to make a motion for that, or is there any objection to it?
No.
Okay. Would you
No objection.
include that? Okay, thank you. Commissioner Overman, you recognize.
Thank you, Chair. We've been talking about a lot of the federal packages, and Mr. Merrill's made reference to the finances and how we make sure that we can cover the things that we need. We had good news from Congresswoman Castor regarding the federal emergency package for HART and for CDBG and homeless and housing. Are there, and this probably is questions for Mr. Wagner, are there requirements such as for transportation in that last package that we got in the legislation for local governments and agencies to have either matching dollars or matching resources for these emergency aids on a reimbursement basis, or are they on a reimbursement basis? I think that's going to be important if we start utilizing these funds for a variety of sources, a variety of reasons. But are they required to be matched by the local organization? We don't want to get out of line, is what I just want to make sure we're able to apply for as much as possible to meet the needs of our citizens.
Commissioner, this is Brandon. I will double check on that, and I will get an answer back to you.
Thank you, sir. I appreciate it.
Mayor Castor, you recognize.
Thank you. A couple of things. One, with the scooters, first of all, the use of those is down dramatically, but each of the companies, they clean them 3 times a day. They pick them up and clean them. And there's the idea that they're only used in the downtown area, but they're actually distributed throughout the city. And they're used of modes of transportation in a lot of the lower income neighborhoods as well. But the usage is down on those. And I also, as Mr. Merrill did, called up Joe Durkin at Spectrum to find out what the issue was with the provision of hotspots and internet access for our community. And they have made all of their hotspots throughout the city free. And then any family, any person who calls in with children get the service for free. And all they have to do, they can pick up or have a modem delivered. And then the instructions, he said, are very simple, which means everybody but me can probably hook it up. So that's I think that that's a great service that Spectrum is providing to our community. And then I have the superintendent of schools is going to be on a Facebook Live program this afternoon to try to answer a lot of the questions with EDSB and a lot of other things too. So hopefully that'll clear up some of the questions with access for schools. That's it, sir.
Thank you. Mr. Merman, you recognize.
Thank you, Mr. Chair. When you mentioned about the raising of the rents, I actually feel that that is price gouging, and you should report to the Attorney General's office. I think that is outrageous that these landlords are increasing rents when they know some of their tenants do not have jobs. And I actually would. I would test it. I would report it to, I sent it to Nikki Fried. I sent it to our own Attorney General here from Hillsborough County and see if they can do something that route to help put a stop to it.
I'll do that. I will definitely do that because I've gotten many calls starting the first part of the month from people calling and saying, my rent's been raised. What am I supposed to do? And I've lost my job. And last week and today, it's been overbearing the number of phone calls I received about the raising of the rents. And not just, some people just can't pay it. They just cannot pay. They can't pay what they're paying now. And now the rent's being raised.
I've gotten those same calls. Appreciate you bringing that up.
Thank you. I don't see anyone else's hands or any other discussions at this point. Any others? Mr. Merrill, anything you need to bring forth?
No, sir.
Okay. If there's no other discussions, we have another call or another screening, another video, whatever we want to call it. Let me thank staff for putting this together. They've worked hard over the weekend to make sure this happens. And they got with me and taught this old guy how to use this thing. And I'm not technologically the smartest guy in the world, and they had made it very easy for me. So I want to thank them for all the work they've done in putting this together. So thank you very, very much. We have our next Emergency Policy Group meeting on this coming Thursday at 1:30 p.m. They'll be getting more information out to you as we get closer to that date. So if there's no further discussion on any subject matter, I'm going to declare that this meeting is adjourned. Thank you.